RFK Jr. is on Capitol Hill, and it is not with the warmest welcome that RFK Jr. is finding his testimony being greeted. I would say, Albert, we have multiple choices here. Let's go first with that last little clip that I sent you. This is RFK Jr. Again, I'll play Elizabeth Warren with RFK Jr. These clips run a little bit in length. We can do that on the show and kind of give you a little bit more. But here is RFK Jr. on the Hill this morning. This just happened a few moments ago.
Mr. Secretary, I agree with a lot of my colleagues' statement. I actually had hoped I didn't support you.
Those of you who stop for a second, those of you who are only listening and not watching, you are missing the fact that he is incredibly tanned. I mean, RFK Jr. looks to have just come off the, I don't know, the Amalfi Coast, the Riviera, Kennebunkport, where the Kennedys have a compound. It's unbelievable. I mean, I can't, you know, for a guy who's working, it's incredible that he has as much sun. I mean, believe me, I wouldn't be pointing it out were it not so insanely prominent in the way he looks.
He also has that posture where he's just kind of slouching in his chair like he really doesn't give a rat's ass.
Yeah, I'm going to give him that because it's a long thing. But yeah, people are saying spray tan, whatever it is. I don't know what but man, but you're right. He's certainly not sitting at attention. He's kind of like, yeah, whatever. Let me get back to my tanning bed. All right, go ahead, Albert. Sorry.
Secretary Kennedy, thank you for being here. In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on big pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed big pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone. It costs patients up to $175,000 a year, draining Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the big, beautiful bill. So despite the hype with executive orders and Washington Republicans only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs, meanwhile, Democrats finally have allowed Medicare to negotiate drug prices. I will say that Keytruda, along with Opdivo, and Darzalex, the three top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years, if not permanently. So my question to you, Mr. Secretary, is how do you justify claiming to take on big pharma while supporting a bill that shields drugs like Keytruda and other cancer drugs from Medicare negotiation, costing seniors and taxpayers billions and risking the lives of cancer patients who cannot afford their necessary medication?
Yeah, Senator, I appreciate the question. The Medicare drug negotiations in the IRA were very well intentioned, but they were poorly structured. And what we found is that the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in negotiations.
The CBO has not agreed to that. The CBO doesn't say that. It's just the opposite. So you're saying the CBO and independent agencies that validate the costs are wrong?
Well, that is CMS data.
Okay, so let's just focus on the cancer drugs. Why aren't we negotiating those and bringing those down for families? Why does the bill exempt those?
It's part of the MFN negotiations. I'm not sure that provision in the bill of the one beautiful bill, but you're
not sure of the provision, the negotiation provision, and how exempted
for Keytruda.
Your agency is responsible for that negotiation, and you don't know about it?
I know that we're negotiating in the MFN.
Let me ask you this, Mr. Secretary. Let me ask you another question. How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you,
Are you talking about the
they are
rate?
going to pay $15 more than last year, up to $50 a month. Now, let me have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year?
I don't know. I talked to
So
Dr. Oz
that
about
is
it
about,
yesterday. I think
they're
it's
supposed to increase about
16%.
11.6% or $21.50 more each month. And again, last time you were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. You know, next year, seniors and families are facing higher healthcare costs across the board. 23 million people on Medicare with a standalone Part D drug plan could see their premiums rise to $50 a month, up from 35, because the Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6% to $206 a month in 2026, one of the largest single-year increases in decades. And so for an administration that claims it is lowering costs, my question to you is, what are you going to do to keep costs down for seniors?
I mean, I'm already doing I'm already keeping costs down.
What are you doing to keep costs down for seniors, knowing that these costs are going to be increasing?
I mean, the program integrity bill, that is the first action that I did when I got in. It's one of the earliest actions in history of a complex regulation by an HHS secretary. A congressional budget office has said that that's brought premiums down by 5%. That is the congressional budget office, which does not like to acknowledge anything that we do.
And does that impact seniors?
Excuse me?
Does that impact seniors? And I know my time is running out. Does that impact seniors? What you just talked about, you're lowering costs. I'm asking you specifically.
We're lowering
for helping
costs.
Seniors. Does it impact seniors?
Does it impact?
Come on.
Let me just stop you.
I didn't
My
hear
time is
what
running
you
out, so
said.
I appreciate the chairman's indulgence here. My concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
I didn't hear your question.
Okay.
Yeah. Okay. You get the idea. He's swimming away from it. And that's just that's Catherine Cortez Masto. She's from Nevada. But I want you to know that's just a sliver. The guy gets rotisseried. And I'm going to play you another cut just because I want you to realize. And then I'm going to give you the news of the day, which is, and again, this is so far, that was about money. Okay. And it's important because in American healthcare, it's all about money. We're unique in the world with this crap where if you run out of money, just let people go and they end up in the grave. If you have cancer and you can't pay for the medicine, you're just screwed.
Yeah.
And this is America. And so she's right to talk about these areas in which seniors and others who need good coverage can possibly get a break. And she's right, Catherine Cortez Masto is, to mention that which was, and as you know, I thought it was almost tepid. Just 10 drugs were identified, at least initially, in the Biden plan, that huge piece of legislation that went through that finally got Medicare the ability to negotiate drug pricing down on diabetes medication, on cancer medication, on this sort of thing. So she's right to talk about this. And the loss of this stuff as a negotiable, navigable area where you might at least be able to give some break to those who desperately need these medicines. She's right to focus on that. This is leaving aside, is the point, the immunization controversies, which are, to call them controversies is to be polite. It's a mess. You fired the CDC staff associated with vaccine approval. You fired the advisory board, everybody on it. You got rid of, you just decapitated everyone. These are esteemed public servants who have tremendous credibility in the area of medicine and these recommendations that are required for vaccines. You've just gotten rid of them, and you've repopulated these agencies with your anti-vaxxers. I mean, at minimum, wouldn't you concede, RFK Jr., that you're doing the very thing that you accused the prior administrations of doing? You're saying, prior to your ascendance to running this HHS that it was all one-sided. It was all pro-vaccine people. Well, what is it now? It's all anti-vax people. So you've gone the other way. I mean, so at minimum, you're as guilty as they are. And worse, you may be tanking the health and welfare of the American people because of these crazy policies and voodoo medicine that you're making part of the American governmental posture toward vaccines. Albert, play me the first cut that I sent you. I think that relates to some of this vaccine stuff that he gets into. Again, this is just a couple of hours ago on Capitol Hill, RFK Jr., the tanned Secretary of Health and Human Services.
Hey, I agree with a lot of my colleagues' statement. I actually had hoped, I didn't support you. I thought taking on chronic illnesses was going to be important. I've got 2 kids, as we discussed when we met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
What?
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there
So
was
I'll
so
take
many perverse
sir,
incentives. And these are
you don't know the
studies.
answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months and you don't know the data about whether the vaccine saved
and that's
lives?
the problem is that they didn't have the data. The data by the Biden administration absolutely dismal.
So when
Data
so you
chaos.
who is politicizing? You're saying the Biden administration politicized all the data? Go back to what
Yeah.
Senator Cantwell just
They
said.
fired Dr.
Go to
Krause.
the Trump Surgeon General.
They fired Dr. Krause. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krause.
So,
Krause,
Mr.
Martin
Chairman, the
Gilmore.
Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you got to one. I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there is not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean,
Very good. Very good. Thank you, Albert. We've talked about this at length, the fact that these rural hospitals remain dependent essentially on federal monies coming in. It's not just the individual who is insured by Medicaid. It's the fact that the Medicaid monies, that stream supports the hospital in many other different ways. So you end up essentially subsidizing a lot of what the hospital can do because of Medicaid money coming in. So when you have cuts to Medicaid, that's the reason these rural hospitals are closing. I now want to just turn to the vaccine situation. There are, let me just see what my time situation. Yeah, play me a little Elizabeth Warren, and then I'll talk to you about and mention what is going to happen more and more in America, which is that states are realizing, oh, the government is being dismantled. It's being run by a bunch of crazies who are on this ridiculous jihad They got in. I think this administration got in. I know a lot of single issue voters who are anti-vaxxers. That's all they care about. So now you've got the anti-vaxxers having taken over the CDC, HHS. You have Americans' health care being determined by utter quackery. It's not a measured, balanced review of information. As I say, it's zealotry. So that's where we are. And you can expect that states are going to begin to take on the role of the federal government in ways that will allow them to create their own vaccine policy. More on that in a second, but here's Elizabeth Warren.
Thank you, Mr. Chairman. So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise.
No, I didn't. I never promised that I was going to recommend products for which there is no indication.
When you said.
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary, you
want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world So that
I
without
want you
any
to
clinical trial
follow
data.
Through on your promises.
Yeah, my promise was to give,
A month ago, we could get COVID vaccines by just walking.
you can
into a
still get
pharmacy.
COVID vaccines,
You are
Senator.
taking that away.
No, you are
So
still,
let
you
me
can
ask
still
you
get the
one more
COVID vaccines, and
question,
Medicare
Secretary
will still
Kennedy.
pay for them, and Medicaid
You
will
tell
still
the
pay.
head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has
Well,
said.
I'm
she
not
was
surprised about
reapproved.
that.
So you're saying she's lying?
Yes. Every conversation I had with her, there
And
were
let me get
witnesses.
this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. And you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar? Is
Yeah,
that what
you
you're
should
saying?
ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted
Now I
against her
agree with
because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look,
Nice
you are
job.
putting
That's that. I wanted to give you a good, healthy chunk of that. So that's the back and forth that I think has typified a lot of the conversation around what we've seen. And I'm just noticing something. Is this a reverse image today, Albert? Are you seeing a reverse image from me?
No.
No. Why am I seeing a reverse image on my screen? You see what I'm talking about, Albert? No.
No,
Okay.
I have
Everything-
noticed that when you're playing music in the background, your mic kind of gets distorted. But that was only when you had some
This is
dueling.
weird. I don't know when I
audios,
can.
but-
I don't know when I can adjust this. When you drop this video, you'll cut this part out, and I'll get back onto Elizabeth Warren in a second. But it's just an odd. I'm seeing something strange right now.
That's weird. Well, we see normal things.
You
so-
do? Okay. All right. So yeah, Mark, please don't get distracted. Is what you're saying? Okay.
Kenny Smith says, not true. I tried to schedule my COVID booster and I had to qualify.
Yeah. You
Thank
have
you for the
to.
contribution. Yeah.
Yeah. Thank you, Kimmy, for that. What you're seeing is, first of all, I loved kind of I thought Elizabeth Warren stuck the landing there when she talked about the firings at the CDC, because clearly these are, even for those who were brought on board by RFK Jr., his demands have become so outrageous that they just can't countenance them, and they're not continuing at the CDC. That was the reason for the most recent firing. But what's happened is as the vaccine availability has melted away and it has no longer the federal government backing, states are beginning to band together to try to make some plan for a health alliance. And this is happening in Washington, Oregon, and California so far. There may be others that will join. So COVID-19 cases, as you know, are rising. There's a huge surge in COVID right now. And the CDC restructured, you could say, downsized. It has been, I'd suggest dismantled in many ways. I mean, this really was the shining star of medical research. Some of the greatest scientists and doctors in the world came through the CDC, resided at the CDC. In fact, it was viewed as, from the rest of the world I'm talking about, a place where research crescendoed into policy. And now you're seeing Washington, Oregon, and California saying that we'll have an alliance and safeguard health policies here that we think will protect the public.
It's like a vaccine alliance. 'Cause
Exactly.
they can see that people, unless they have to meet a certain set of qualifications, be 65 or older to get the COVID booster. Well, what if I want the COVID booster? I'm not 65. I can't go out and get it now. I can't go out and get it for my kids either.
Washington State Health Secretary Dennis Worsham said public health is about prevention, preventing illness, preventing the spread of disease, and preventing early avoidable deaths. And of course, as an aside, we've mentioned it before, there's no question that modern vaccine technology has tremendously, I mean, in a watershed way, changed life expectancy and longevity. I mean, disease was the great threat to humanity. The human species was culled by these diseases through generation after generation. And if it didn't lead to death, it could lead to horrifying consequences. So these vaccine technologies are critical in taking us to this other level. And here's the quote from the Oregon Health Director. Vaccines are among the most powerful tools in modern medicine. There you go. They have indisputably saved millions of lives. But when guidance about their use becomes inconsistent or politicized, it undermines public trust at precisely the moment we need it the most. So there is medical advice being sought, and there are many in Oregon, in California, in Washington. I'm talking about leading public health officials who are getting together to, as Kim has suggested, sort of form a vaccine and healthcare task force. So,
And how ridiculous that we should have to do that.
it's what's happening increasingly across so many different policy areas, right? And of course, the administration is offended by this. And so HHS says, quote, Democrat-run states that pushed unscientific school lockdowns, toddler mask mandates, and draconian vaccine passports during COVID's era completely eroded the American people's trust in public health agencies. We remain the scientific body guiding immunization recommendations. And HHS will ensure policy is based on rigorous evidence and gold standard science, not the failed politics of the pandemic. By the way, first of all, there was a lot of disagreement about policy during the pandemic. It was kind of being, I think, put together on the fly. The mask mandates, the mask strategies, the mask research. It was being reinvented along the way. I think that the same is true of the vaccine. The vaccine, insanely effective initially, and then as the landscape of the virus changed, the mutations of the virus were way ahead of the vaccine changes. And so you ended up with a vaccine that would keep you out of, in general, serious health problems, that would hospitalize you from COVID, but you didn't end up with a vaccine, as was sort of represented early on, and we spoke frankly about this, a vaccine that was like, gonna be making me bulletproof. I don't want to get COVID at all. That's why I got the vaccine. Just like polio, just like smallpox, etc. Yeah, the problem was that the landscape of this virus was changing, as I say, to the point that there was no way, apparently with existing medical technology, to really make us bulletproof. So we ended up with this mRNA technology, which is incredibly powerful and interesting. I read a book on it, and I forget what it was called, but it was really, it's got that CRISPR technology. I think that's an anagram for something, or not a what do you call that? When you put letters together it's a, anyway.
An abbreviation?
No, there's another word. But anyway, that technology allowed them to, it comes from cancer research. It allowed them to modify the vaccine, month to month, year to year. So there was a lot being learned on the fly in a way that sort of we're building the plane while we're flying it. That metaphor, I think, applied a bit to COVID-19. But because of those failings, we end up with all of these different cross currents about medical technologies, medical recommendations, the gold standard. It wasn't double blind. I mean, they were trying to stop the bleeding, to be fair. And I think in an effort to stop the bleeding, they aggressively went after this COVID-19 virus with this technology, which did prove effective in keeping a lot of people out of problems with the hospital, particularly those with comorbidities and even those without comorbidities. So I don't know. Acronym, that was it. Thank you, Adam Cohen. And it is a ding word. I don't know where we all end up on this, but I know that the complete clearing of the table of all of these vaccines that have proven so effective through the years is utter lunacy. And I think RFK Jr. is an utter loon. I mean, I've come to the realization, as maybe many of you have as well, that he is so much a political operative that it's grotesque to watch him, like everybody else, just vomit up a bunch of compliments to Donald Trump and then all the disparaging comments about Biden. It's again, American politics has taken on an ugliness, and I'll play you another clip here from Miller in a second, and you'll just see the way we've changed as a society, the political discourse. I'm not suggesting everything has to be, bow ties and cocktail parties, but I do think the degree to which we've seen everything degraded from information to political discourse is pretty gross. So that's what you're seeing played out. I mean, that's sort of the coin of the realm in Washington. The grosser, the more you smear, the more heat you throw, the better you are, the more valued you are politically. And RFK Jr. fits right into all of that. But that's what's happening with the latest there. I mean, I have friends who actually got polio. They were right. Bill Mann, who's a viewer of this show, he's been on the show talking about it. He got the vaccine, the polio vaccine, a little too late. So he's been free of polio for most of his life. But now, as an advanced senior, he is beginning to demonstrate and be affected by many of the symptoms of polio. So I think we've gotten, I talk about this all the time, we've just gotten complacent. We're not a serious crew anymore in America in many ways. And so we succumb to the bullshit of Joe Rogan and of the anti-vax jihad. And it's dangerous. And it's now in charge of public policy.
It would be embarrassing to watch him, RFK Jr., sit there and not be able to answer the questions and reveal himself to be completely incompetent if, as you say, it weren't so dangerous to public health.
Indeed. Yeah, Blue Spark is right. The polio vaccine was considered an absolute miracle when it was developed. Yeah. Thanks for that. David Katz, the brilliant legal analyst. I think he's one of the great legal analysts in the English-speaking world. He joins us in just a few minutes. I want to take a moment. I'm going to play you that Stephen Miller cut in a second to recognize a couple of you who have joined the conversation through Super Chat and Super Stickers. We are live with Super Chat and Super Stickers through the entire show. And I give you Luis. What makes idiot RFK Jr. qualified for his job? I'd sleep better at night if Albert was on the job.
Yeah, so would I.
Albert, thank you.
Albert, at least his lower standards would be a vast improvement. Wow, Albert, I think you've been, that's a backhanded compliment.
He'd walk in, he'd go, you know what? Everything looks to be running fine. I don't really need to do much here.
Yeah,
I'm just going to sit back and let it roll.
Albert would be in Hawaii half the time. At least you'd know where he got his tan. Joan Hollywood says, every time you ding, the dogs run out the door to see who's here. I'm sorry about that, but a big shout out to you.
Big shout out.
Yeah. I hate to say it, but I work in Florida, says West Theory, and write software for a nurse staffing company. I have a feeling business is going to tick up soon. Yeah, we're getting sicker and we're going to need more nurses. Thank you, Wes, for the $5 super chat. Yeah, I mean, I can't disagree. I mean, sure, if you had to, just take the temperature of the patient right now, it's pretty, sadly, running a fever. Wes says, RFK did get a good one-liner that made me laugh. Why do you care? I fired her. You voted against confirming her. Yeah, about the CDC director who he fired. Yeah. My God, Trump can pick winners. Misogyny gone wild, says Harry Magnum with a $5 super chat. Yep. And Luis says Florida once again distinguishing itself as the mecca of ignorance, equating effective vaccine mandates for children to slavery. Welcome back, polio. Yeah. Thank you for that. I mean, it is scary. The logical extension of what we're seeing is serious. And
on that note, just talking about, the differences in vaccines, I saw this article where a health expert is saying, you know what? You probably in the next coming years don't want to take your kids to theme parks in Florida. Like, this is a place that you would want to avoid because they are changing the vaccine rules in Florida. And so perhaps it's going to be this hotbed of disease that you want to avoid. And I wonder if that will affect business at places like Disney World, Epcot Center, Universal Studios Florida, all of these places where, you bring kids and God help you if you run into an outbreak when you go there.
well, there was a measles outbreak, as you know, in Southern California at the Disneyland there. And Kim is right. The renowned infectious disease expert, Michael Osterholm, just yesterday warned of the potential fallout from Florida's move to end all vaccine mandates in the state, especially for school children. He said it may be a hotbed of transmission. Those were his words. And he said, I wouldn't want my kids going to Florida in the years ahead to go to Walt Disney World or any place like that, a congregate setting. He's the one who wrote that book, The Big One, Why Future Pandemics Will Be Worse and How We Must Prepare. This book is out next month, and it summarizes the public health policies of President Trump's second term. So, yeah, so much of what you say and what he warns about is now being talked about openly.
Hi, it's Mark, and I thought that was great. Hit the notification bell. You'll know whenever there's a new video being dropped, and please subscribe to our channel to help us save the universe.